Thank you, everyone out there in Zoom land and Easthampton Media, Jen Ramsey, for pulling this together and for all of you to participate. In these just unprecedented times, I really miss hearing directly from people as I'm walking around town and seeing people at public meetings. I thought Zoom would be a great way to restart the conversation directly between the residents of Easthampton and their government. This is our first adventure into a virtual town hall format. And I wanted to start with some real basics of how we're keeping our city as safe as possible in the face of really an unknown new virus. So I have Bree, our health agent, Dan from Fire, both on this town hall with me. Bree has really been at the forefront of putting together policies and orders that work for Easthampton. You know, we've gotten some guidance from the state and the federal government for sure. And the ghost hero behind public health orders has been Maggie Hebert, who I see is also on the call. She's the chair of our local board of health, who we all found out wields a great deal of power during a pandemic, the chair of board of health. So I'm not sure how Maggie feels about that. Maybe she will share. But to start off, I'm going to ask Bree to walk through kind of the orders that have been put in place. And I've gotten a lot of questions about the orders that have been updated and really have evolved. Bree, can you take it away?
Sure. So we have, we're trying our best to keep up with the governor's orders, which sometimes change every day. And what we'll do, the Board of Health has authority to be stricter than state law. So we'll usually take the governor's order and then also add to it and make it a Board of Health order regulation. So we have a couple out there right now. The main ones, I think a lot of people know, the playgrounds have been shut down, basketball courts, tennis courts, because we want to really avoid people congregating, playing close contact sports and such. And that goes for all public and semi-public. And semi-public would be apartment complexes, condos, things like that. The other order that we have out, which really encompasses most businesses in the city, it's any business that remains open to the public. So grocery stores, pharmacies, convenience stores are kind of the main ones. And some of the things that have been in place, I'll go over those first, and then we'll go over what we're looking to put into place either later today or later this week. Some of the things that are in place now that you'll see in town is there needs to be the social distance markings at the register. So you'll see 6 feet of distancing marked out. A lot of times it's with tape, duct tape, or cones or something along those lines. All self-prepared food stations are prohibited. So no longer can you make your own coffee, frozen drinks, soft drinks. Gloves should be provided for the cashiers and employees. There should be 2 signs that are provided by the health department posted on both entrances. Food establishments are now curbside only, so no longer going inside to order your food. You should be doing it over the phone and then picking up curbside. And those are kind of the main points of what's existing. Some of the things that we're looking to put into effect is disinfecting the counters, credit card machines after each customer. So just spray and wipe down after each customer coming through. Putting up plexiglass partitions between the registers and the public. That was strongly recommended, but a lot of places have those in place already, but that's going to be a requirement. And that includes drive-through windows. We are going to require employees to wear cloth face coverings in public when they're working. So grocery stores, pharmacies, convenience stores. And we want to be clear that these are non-medical grade, and Dan's going to touch on that later, more about the mask, but they're mostly cloth face coverings. And we are currently soliciting donations for those to be dropped off at the public safety complex in the dispatch center, so we can help get those out to businesses that, you know, have a bunch of employees where they might not be able to make them fast enough or find any. And the governor ordered grocery stores to limit their occupancy to 40% of their occupancy that's already allowed through the building commissioner. We are also requiring large food retailers to do that as well. We don't have a lot, but any of the larger food retailers, so Family Dollar, those types of places as well. That occupancy count includes customers and employees. This is new, that's going to be coming out. The aisles will be one way. Those need to be designated as one way with some type of marking to avoid customers coming and going face to face. It should be all one way. They should be entering through a door and exiting through a different door. Hand sanitizer shall be provided at the entrance and exit. Disinfectant wipes shall be provided to customers, and gloves shall be provided for customers. And again, that's just grocery stores and large food retailers, and that's coming down the line once we kind of shore that up and finish it up.
Great.
And then I can touch on Maven too if you wanted me to do that, Mayor.
I would, if you could maybe get, Bree, if you could walk us through what Maven is and what it does for the city and the departments, and then just to give people kind of a preview of what's next, Dan from the fire department will walk us through mask use as well as glove use, and I'm going to try to get him to tell us a little bit about what he was doing in California, which is fascinating and very courageous. Before I let you go on, Bree, I will share that Williston reached out to me this morning, and they have purchased 1,000 cloth masks for the city, for departments and employees in the private sector, and we should be getting those next week. So we've got 1,000 cloth masks. I also know Western Mask has a large presence on Facebook, and they're making masks as well. So if you could walk us through Maven, and then we'll shift over to Dan, and I'm sure people would like to ask questions after that. So I want to make sure people know question and answering period's coming. Take it away, Bree.
So Maven is the mass virtual epidemiological network. That is where anyone who is confirmed with COVID, or if they're a confirmed contact, which I'll get to what a contact is, that gets sent through this system to the health department, the local health department. And that is sent to us through the primary care, the hospitals, the labs, anybody who does the testing, it gets put into the system. From there, we have contracted with Northampton Health Department's regional public health nursing program through funding from DPH, and they have a whole team of nurses that have taken on some towns, they've taken on us, and they do the contact tracing. So when a confirmed case comes through, they contact that case, they call them twice a day until their symptoms are relieved, and they do contact tracing where they figure out who they've been in close contact with. Close contact is within 6 feet for 15 minutes or more. So a lot of people are calling and asking, are you going to tell us if my neighbor has COVID? And technically, if you are a contact of that person, you should be getting called from a public health nurse. And then those contacts also get added into Maven, and then they get traced. Their contacts get traced as well. The only concern with that is there is a lack of testing right now. So there are some people who very well may have COVID and have all the symptoms, but they might not have availability for testing. So at that point, their primary care physician should be educating them and doing their contact tracing. So we at the health department do not know every single COVID case, but we do know all the confirmed and all the confirmed contacts.
Great, thank you, Bree, very much. That's let's have Dan do his 2 presentations and then open it to question and answers. Dan?
All right, sounds great. Thanks, Mayor. First thing I want to talk about is the use of masks. So it's extremely important when you're out in the public, really, to have some type of mask on, and you can make the masks at home from just common material, a t-shirt. I have one here. There's a great video, if you haven't seen it, on the CDC's website, from the Surgeon General, makes it with basically just kind of a t-shirt, kind of cut up in little areas, and you You put some rubber bands on either side like that, and then you can just put it on like that over your ears, and you can kind of adjust it a little bit like that. So that's one homemade one that you can make there. Also, you know, if you have access, if you have surgical masks, the surgical mask is also one that you can use also. When you put that on, you want to put it on, and it goes over like this. You want to make sure, I should say first, right? You hand sanitize, right? Get the hand sanitizer first. So that's really important. So you want to hand sanitize first. I'm jumping ahead of myself. Okay. And then you want to put that mask on, and then you want to adjust it right over the bridge of the nose there and stuff. So that's really important. And when you take the mask off, you want to make sure you take it off and put it in right into the trash when you're done with it. If it's a disposable type of mask, you want to do that. And then once again, after you do that, you want to hand sanitize. It's very important. So that's what we do, you know, as healthcare providers. We're always hand sanitizing before and after each personal protective equipment, a piece of personal protective equipment that we put on. So when we put on the gloves and et cetera. So that's the surgical mask. So the other mask that also that we use on the higher end is the N95, which you've heard quite a lot of and stuff. So right now we use these as healthcare providers, and when we put these on, again, the way to put this on is to, again, properly hand sanitize first and stuff. It's really important, okay? And then what you want to do is when you put like an N95 on, or even if you have a dust mask very similar to this, you want to put it on like this, and you kind of put it over your head like that, and then you pull one strap over like that, and then you pull the other strap like this. And again, this is the higher end mask. And then what you want to do is you want to kind of ride on the top of your nose there and stuff, and kind of mold that to it. And then you want to cup it and make sure when you breathe in, make sure that it, you know, it's sucking into your face and stuff. The difficulty is sometimes with people with glasses, right? It's fogging up too. So when you're wearing those with glasses, that could be it. So I've got my N95 on here, and it's good. As far as glove use goes too, we have our regular type of nitrile gloves here and stuff. So putting them on again is pretty, I go back to my hand sanitizer, right? So I hand sanitize here. I'm gonna hand sanitize really good. All right, and then we got our gloves. We're gonna don our gloves. We'll put them on like this. That on, so we have our gloves. So now we're good to go with our gloves. Taking off your gloves, we call it doffing the gloves. So this is the important part as far as taking them off. So first of all, again, back to the hand sanitizer, to be really safe, we can hand sanitize, you know, kind of do a quick decontamination of the gloves and stuff like this. And then when we go to take off the gloves, what we want to do is we want to kind of grab the glove like this and pull it like that, so as not to contaminate, and then underneath here, underneath the wristlet, and then pull it back underneath like that. And then we can go ahead and we can dispose of that in the trash and stuff, what have you. So that's how you do that. To doff the mask, once again, to take the mask off, again, it's just gonna be kind of reversing it. Remember though, you know, this side of the mask is kind of what we call the dirty side of the mask, especially, you know, in the healthcare field. I'm going to take those glasses off. Well, now everybody's fuzzy. So to take off the mask, again, you're going to just do it the reverse way, right? You're going to take the strap off like this, and then like this. And then you're going to go ahead and you're going to want to throw it away. Now, if you've touched the outside of the mask, you want to make sure, again, hand sanitizer, okay? We're going to sanitize our hands, you know, very good with that. So the key is once again, is just, you know, using the hand sanitizer in between that, those steps. As far as the cloth masks, we also have some other cloth masks, and just to give a kind of a shout out to the folks in the community and stuff. We've had a lot of people making these and donating to us, and we thank you for that. been very supportive in this time and stuff. So we've got a cloth mask here that we can use. The important thing with a cloth mask is, is you want to make sure you launder it, and I would say launder it daily. So if you've got to make a couple of cloth masks, use maybe once a day, and then kind of cycle it into the laundry. That's really important. If you have a mask like this that has the kind of the strings on it and stuff, what you want to do is kind of like tie it around the neck first here a little bit. This is the one that doesn't have, some of them that they're making are really nice. They put the elastic bands that go around the ears, like the disposable ones. But you've got that, and then you kind of take it up like this, and you kind of adjust it up like that. And then you tie this one, and you might have to go back and once again, adjust that a little bit here and stuff. Tie it above the head here. That. And then once again, adjust, you might have to adjust this one a little bit more to make it. And then again, doffing it would be kind of a similar way, would be to take it off. A similar way would be to untie it here and here, okay, and to remove it off. And again, always treat the outside of the mask too as if it's contaminated. Hand sanitize, before and after using the mask. So these are really important. I really, encourage people to wear the masks out in the community and stuff. It helps protect the folks around you and yourself and stuff. When we're working in the station, if we have to go out of the station, everybody is wearing a mask. If we go on calls, I just want to touch on that kind of briefly. So our EMS calls now have changed quite a bit. So now what happens is when we respond out for EMS calls, what we do is this: when we get on scene, the technician, one of the paramedics, will don in full PPE. So what does that mean? So they're going to put on a gown, they're going to put on an N95 mask, they're going to put on goggles, and they're going to put on gloves. And what they're going to do is they're going to make patient contact. Meanwhile, the driver of the ambulance is going to, the other paramedic or EMT is going to stand by the ambulance and wait to see what's going on. So what we're doing is we're trying to minimize contact with healthcare provider and patient. And the first thing that the tech is going to do when we call him the triage tech, when he walks in, he or she's in full PPE, going to address the patient and stuff. First thing they're going to do is we're going to give you a surgical mask. So it doesn't matter what your complaint is. If your complaint is, I fell down, I think I broke my leg, it doesn't matter. At this point in time, we're giving everybody a surgical mask and stuff to help protect them, to protect the folks around. And then we're going to obviously we're going to maintain our 6 foot in talking and kind of doing a triage to see, okay, what the complaint is and what's going on. And then we'll take it from there. If we have to, we'll call in the other tech. The other tech will get dressed in PPE and come in. We've set up the ambulance on the exterior with 2 exterior compartments that have a donning station and a doffing station, and we have personal protective equipment for the paramedics and the EMTs, and they can don and doff there. And our police officers can also use those if they have to get into medical personal protective equipment. So things are a little changed up, a little bit different from what we were. We're also, some of the people who have flu-like symptoms, if they meet a certain criteria and we feel it's safe and they're agreeing, then they're staying at home, because that's the best thing. If they've got family to take care of them, somebody else to help take care of them, or they can take care of themselves, and they don't have any of the risk factors, medical risk factors, then we're encouraging them to stay home and take care of themselves. But they can always call us back and stuff. So we're not refusing anybody transport at all. But we're just doing business is a little different nowadays with how we do things.
Great. Thank you so much, Dan. It might sound a little unusual in the middle of a pandemic that you decided to go to California, but could you just share like a minute or two of why you decided to go to California?
Sure. So I'm part of a disaster medical assistance team. So I get, in time of emergencies, sometimes I get federalized, and we'll come together, and we're basically a group of, our team is MA2, DMAT MA2, and we're out of UMass Medical Center in Worcester. And we come together, doctors, nurses, nurse practitioners, PAs, paramedics, pharmacists, mental health and support staff, and we usually will deploy a 35-person team to an area, and our job is usually to help bolster the medical infrastructure out there. So we were called to help out, and at a peak we had, a few weeks ago, we had about 1,500 folks from NDMS, from people from all over the country who kind of do different things in their lives, come together. And we went to California. We actually opened up we worked with the Office of Emergency Services for the state of California, and we opened up a alternative care center, a tier 1. Basically, we took a hotel that had been emptied out, and we changed it into a hotel that had it was accepting patients COVID positive and PUIs, people were under investigation. So we basically took care of the folks that were coming off the Princess cruise ships and stuff. The ones from they initially went to Travis Air Force Base, and now we were accepting those that were they were symptomatic and it came through as positive. So we did basically, we ran a hotel that was basically quarantined. So we had to do all the services of a hotel, from providing the medications to finding out where their luggage is, to fixing their toilet, to fixing their television set, all in PPE, and kind of run a hotel under that auspice out there.
So we can expect you to add that to your resume, your hospitality management.
Yeah, exactly.
Right.
I was actually able to run the front desk and make key cards for rooms and stuff.
That's dangerous for everyone to know. I mean,
yeah.
Wow.
Yeah,
next family gathering,
I know it's interesting. You never know when we deploy out what we're going to do. We might do that. We might be evacuating somebody off of helicopters, like we did at Katrina, or who knows. It's pretty interesting.
Well, thank you very much for sharing. Jen, are there questions that folks have for us? Oh, I can't hear you.
We got one question in the chat from Bonnie Shew. I don't know if you'd like to unmute yourself, Bonnie, and just ask it, or if you'd like me to read it.
Sure. I'm just curious about social distancing on the bike path. Of course, there's people who aren't social distancing at all. I've been making sure I keep at least 6 feet apart from everybody but my husband, but I've seen some recommendations that it be even more when people are exercising because of the breathing that we're doing when we're running or biking or walking. So I'm curious about that.
Bree, do you want to take that one?
Sure. I haven't seen anything out there for anything more than 6 feet, but if that's out there, if you could send it to me in an email. It's difficult because it's hard for us when we're enforcing to know if people are family, because technically you can walk together as a family, but it is difficult. It's definitely difficult to enforce the public if there's just 2 or 3, because to my knowledge, and Dan or Maggie can correct me if I'm wrong, the governor's order is 10 people or more. So if there's 3 kids on the bike path, it's kind of a gray area for us. So that's why we closed off the basketball courts and the tennis courts, because that makes it a little bit easier to enforce any amount of people. But it is difficult.
I mean, I live next to the bike path, and there I somewhat joke, but not. I've changed when I walk my dogs. There's definitely there are peak hours of traffic, and if I can't get onto the bike path by the East Street, by Route 5 area by like 11:30, I wait until 4:30. And when the idea of masks, cloth masks came, just as an anecdote, it was people, with no ill intent on the bike path, and they're stopping and they're talking to people from across, like on either side of the bike path. And then I have to go in the middle, or kids, and it gets congested. I mean, and I agree, but it's very hard, lead by example, and I do remind people, but it's tough. I mean, it's a hard thing to enforce other than to very nicely remind people. So but I do see it on the bike path a lot, and it's concerning, especially those who are older and at risk, you know, and to find a place to walk safely. But the masks make me feel, I made a mask out of my headband, and someone else made me one too. So I'm wearing masks more and more, especially when I'm on the bike path.
There's a question from Kat. I would like to share information about a large supply of medical grade PPE. I don't know if you'd like to speak, Kat.
Yes, please. Thank you. Thank you very much, Nicole, Bree, Maggie, and Dan. I have some interesting and exciting news from Jody Lyons, and she's a DC area infectious disease expert and senior care expert. And she has shared with me a way to get large amounts of medical grade personal protective equipment, everything from glasses, goggles, masks, gowns, isolation gowns, disposable masks, shoe coverings, latex gloves. And this is from Boss Consulting. Chris Kammerman is there conducting an in extremis acquisition through a consortium of suppliers and multifaceted companies. I can share my screen and show you the order form. And I understand that this is the same company that worked with suppliers that the New England Patriots, remember they got that airplane that Kraft sent over. So my understanding from Jody is that there are enough masks and gowns and gloves. It's a purchase order issue. And what I have here is a purchase order for PPE. And I can, I'd be very happy to share that with you. I've been working with State Representative Aaron Vega and Linda Riley, the infection control coordinator at Cooley Dickinson Hospital, and she's doing an outreach to area hospitals. But I would love to share this form with you and make this equipment available to Easthampton.
Kat, can you email the form or take a picture and email it to mayor@easthamptonma.gov, and then I can get it to health and fire and police, and we can follow up? That's great.
Yes, and my actual name, this is my name for security purposes, but I'm actually Jessica Berger. I'm a board member of the Easthampton Public Library Association. I have a background.
I knew you sounded familiar.
Yeah, yeah.
I know that voice. All right.
Yeah. Thanks everyone for having this. Yes, I'll send it to you, mayor@easthampton@ma.gov. Check your spam, please. Not to be bossy, because my email address sometimes goes to spam.
I will check. Absolutely.
Thank you.
A question from Joe Landers. Joe, if you'd like to speak, or I can read it.
I think I'm unmuted now.
Yes, we can hear you.
Okay. So my question had to do with CDH hasn't done this, which seems silly, but a drop box possibly for donations. As a, for instance, I found a small stash of N95s, and with my painting supplies, they would happily accept them, but I don't know when I'm actually going to be able to get up there. And their instructions for where their donation center is at CDH was kind of amusing, since it's the north entrance, which is actually located on the south side of the hospital. So I was wondering if it might be possible to set up a drop box maybe inside the police station if people are afraid that the supplies would get stolen, and maybe try to get someone from CDH to pick them up weekly.
I mean, Dan, please feel free to jump in. So we're encouraging folks to bring those sorts of donations to the lobby in public safety, and dispatch will take them in so they get to the right place. Our police and fire are also seeking N95 and those kind of supplies. So everybody's in need of them, but bottom line, Joe, great. We've been accepting donations at public safety. Dispatch takes them and gets them to where they're used. And it's the safest way for us to do it. And it sounds like it's a lot easier for you as well than to try to figure it up there.
Yeah, thanks. Okay, so
No,
the PD's already doing this. Apparently CDH is not aware there's a drop box.
Okay, well.
Can I chime in for a minute? Okay, so yeah, so we've got a box out in the lobby of the public safety complex. So yeah, feel free to drop stuff there. That would be great. So just to kind of speak on PPE just quickly. So our needs right now are gowns. That's kind of what the need is right now. The immediate need. Obviously, the rest of the stuff is coming over time, but we're doing pretty good on. But it's gowns that that we could use. So I'm just kind of putting that out there. Thank you.
Great.
The next question comes from Ginny. She's asking, is it okay to walk in Nonotuck Park?
Yeah, the Board of Health order specifically says open space of parks you can still access, because we didn't want people to not be able to walk in Nonotuck Park, bring their dog. But our order specifically just closed down some of the basketball courts, tennis courts, that kind of stuff. But yes, the open space of parks are still accessible.
Okay. I don't know, Ginny, if you wanted to ask a follow-up with that. The next question we have is, have you heard when Governor Baker might decide on whether schools stay closed for the year?
No, there's a lot of crosstalk around what might happen with schools. Most school districts, or I should say a lot of school districts, including our own, the school committee voted on Tuesday that what is traditionally April vacation on our calendar will actually be school days. The schools, Easthampton Public Schools has just put forward a remote learning curriculum. You can take a look at it on their website, which is epsd.us. Walks you through it, and the teachers wanted to get the kids into the routine of that new curriculum. The assumption right now is that we're going to just continue on with remote curriculum and wait to see what the governor does towards the beginning of May. But there's no lot of crosstalk.
Okay. Next question.
My vote. Oh,
Yep.
sorry. My vote for that is school shouldn't come back into session. Not that I have a vote, but that's my vote.
Elaine Wood, you're next.
I have a question for Dan. I have 2 cases from the chili cook-off of gloves. Does the fire department need them? Because I spoke with Mike Superson and he said donate them if they need them.
Would you say the gloves?
Yeah, the 2 cases of the gloves.
Yeah, we're pretty good on gloves right now, to be honest
Okay.
with you. I'm
Yeah,
looking
okay.
really good. I can always use some large gloves, but right now we're fine. Thanks.
All right. Let me know if you do, because I have the 2 cases. So.
Okay, I will definitely. I'll keep you on my
Okay.
list.
You might want to check with our local restaurants and businesses, because with all the new orders from Governor Baker and the health department in Easthampton, they're going to be looking for things like that too.
Okay, thanks.
That's all we have in the chat. If there's anyone else that has a question, feel free to chime in.
Can I just add on to a couple of things? I didn't realize I was on mute before. But Dan, spot on with your demonstrations, but I just wanted to remind everyone that even if you're wearing a mask and gloves and everything, you still need to maintain the 6 feet of distancing and, you know, follow all the precautions that have been recommended to keep yourself and those you're with safe. And to the person who is talking about the bike path and walking in the park, like Bree was saying, it's impossible for the city of Easthampton to enforce everything because you don't have people everywhere. So I think it's a responsibility of all of us as citizens to gently, friendly, you know, please, can you maintain that 6 feet of distance if you feel that someone isn't doing that. We have to be our own health agents. So, you know, a good way to do it is to just remind people, oh, could you please, you know, maintain the social distancing, that kind of thing. And that's it.
Okay. I have a question via text. Is Eastworks closed just for the safety of residents, or was there an outbreak? Mill 180 and Keystone are still open.
So I can somewhat answer that. The Eastworks was not, Eastworks was closed. That was the management's decision. That wasn't a Board of Health decision. Some of the businesses in there are essential and some are non-essential. So there was a memo put out by the health department about what non-essential businesses should be doing and essential businesses and such. So there might be some confusion about the closure. I think the closure was more for the public, just because some people, I think, walk in there, like so how some people walk in malls and stuff like that. But Eastworks itself is not technically closed, I don't believe. And I don't want to speak on behalf of the management over there, but.
And there were no COVID outbreaks that we know of.
Okay. Speaking of, there are two related questions. Can you please tell us the case count in Easthampton or explain why we're left in the dark? And why are we no longer being informed of these numbers?
I'll start with that, and then Bree and Maggie, Dan. So I think I shared the case counts for 2 or 3 days, and then really DPH came out with some really persuasive reasons why not to do that. I think when you hear about Maven and how case counts are confirmed, it's a 1 point of data during a pandemic that has multi-points of data. To say we have a certain number of cases, I believe would actually be disingenuous, because we know we always have more cases, and we might have more cases that we'll never find out in places that we don't know. I think fundamentally healthcare and privacy is a right, and it's very dangerous, I think, in times like this, where we start bending those rights because of to calm other people's fears. The data, I think, that is most telling, and what we really need to keep our eyes on are the cases that are around us and within us. So the report out, in the report I put out every day, there's a link, and it's Massachusetts cases by county. And the state, as of yesterday, is going to add race and age to that and give us a little more depth. The virus clearly does not know boundaries. It doesn't know continents or oceans. It's a pandemic. And what might be next to you, whether you know or not, is equally as dangerous as what you do know, or when you're on the bike path. It's the precautions. Unfortunately, you know, we know numbers and we have models, but then we have the virus, and that's the one thing we don't know. And we must be vigilant in staying home. This is really about lives. It's very, the contact tracing and those investigations are getting incredibly widespread and difficult. So that, I don't know, Bree, Maggie, Dan, if you want to add in on any of that.
Yeah, I would just, again, just err on the side of caution and treat everybody like other people that you come in contact with as you're walking around and stuff that are affected, and stuff, and maintain that 6 foot and the masks and stuff. That's really important. That's why, like, we, as healthcare providers, we always wear, use universal precautions and stuff, just to protect people from us, what we might have, or and vice versa too. So it's just kind of like, just like the mayor said, it just being vigilant yourself and stuff, what have you. I like the Johns Hopkins has a great website and their map that really follows the pandemic globally, and it's really updated, and you can bring it right down to like Mayor said, the county and stuff, and keep track of it. So that's really nice that I use and stuff. So if you Google Johns Hopkins coronavirus, you can find that on their website.
Mm-hmm.
Bree, do you have anything to add?
Yeah, so Maven is a great tool for us for confirmed cases, but like we said earlier, testing is limited still. So, I mean, we might have a number of cases that are confirmed, but that's nowhere near what I would say is what there actually is out there. So there could be, a lot of cases out there that we'll never know about. We'll never know about their contacts. So that's why it's so important. That's why there's so many, policies in place from the governor and from the health department. So Maven is good for the confirmed tracing, but there's a lot out there that we'll never know about, because if there's not a test available for them, then they're just staying home. So like Dan said, I would just treat everyone like they do have it. And especially because people can be asymptomatic when they're shedding the virus. So even if someone's not showing symptoms, we really need to be staying home as much as possible.
We have another question from Joe Landers. Any sense of whether business closings will extend past May? Wondering if the State House has given any indication.
That's an ongoing conversation as well. What I'm planning for, and we're trying to line up different supports for small businesses, is to do exactly that. Put the tools and honestly the dollars into a place where small businesses can access them on the most local level possible. No one has a straight answer, but May 4th is right around the corner. Maybe we'd look at different guidelines to be helpful, but I've had a lot of very intense and heated conversations about businesses and projects opening or not opening, and those are important conversations. But we really are talking about lives, and I'm not to at all say that, Joe, you're pushing. And that's it's just very difficult.
I'm not trying to push it. I've got 30 clients that are halfway shut down. I've got 4 mortgages with no mortgage relief and tenants that are closed and out of work. I'm also wondering if there's any possibility that the city will follow Holyoke's lead regarding waiving penalties for property tax payments that are paid by July.
We waived the tax. We actually waived all those fees, Joe, back on March 13th when I declared the state of emergency.
Okay, I don't know that information is on the city website assessor page.
Okay, I thought it was, but I'll double check. Yeah, so all the property, so what we've done so far is, payments that could possibly accrue a late fee or be processed forward as a warrant are all on hold. The late fees will be waived. For the duration of the declaration of emergency. The House just passed a bill, the State House just passed a bill around that I need to look at. I think my order extends past where their order is, and I just haven't been able to get on the phone with Representative Carey to say, but what if legally permitted, of course, we're going to do at least what the state allows us, and if I can go to waiving those fees 14 days past the end of the declaration of emergency. And I completely hear you, Joe. Around mortgage relief and rental relief, I don't want to put the horse before the cart yet.
No, I mean, that all depends on the individual banks, and the word from Feds has been so incredibly misleading because people keep talking about 12-month waivers on mortgages, and the actual waivers on mortgages are being done, I'm going to say racist, because it's only available for single-family owner-occupied homes.
Yeah.
So
I would definitely say
any renters that need delays in their payments because the landlords are risking foreclosure.
We're working on 2 very micro local efforts to help with that. And we're working towards them. I'm working very hard to be able to present them for public comment in the next 2 weeks. I know every hour is important because what we've found out is the headlines from the federal or even state government are one thing, but how it works on Cottage Street or East Street or Pomeroy Terrace is quite different. And so I'm trying to shift some local resources to give some relief to mortgage holders and to renters and those working in the service industries. Okay, and just to be clear, I also realize that the city has limited resources to be able to address this. Absolutely. No, I appreciate. As soon as I opened my mouth in answering your question, Joe, it was the wrong tone. Yeah. No, we're balancing it all, but I do think that there's something, however little or big, I think that the city we can do. We're all in this together, and I think that we need to be creative and innovative around how we redistribute the resources we have. Like, you know, the intent would be that, you know, the ideal is that we all hold each other up and we all get through this standing. So when it's over, you know, people are standing from a standing position. We're already upright and we can go forward. And the longer this, you know, goes on, that's more difficult. So we have to do something at the local level. So I'm hoping to roll something out in the next two weeks that at least is a little something to help.
Next, we had just a comment from Adam.Kinney about businesses being non-essential and contact information. I don't know if you'd like to speak, Adam. If not, that's okay.
Okay.
I work for the Department of Labor Standards, and I'm working with the executive order for essential and non-essential businesses. So we're getting calls and emails and stuff constantly, and people want to know who they can contact. So that's what I was giving, is just the contact information.
Mm-hmm. Safe public workplace mailbox at mass.gov.
Yep.
Okay.
Oh, that's great. Thank you so much, Adam.
Yep.
Thank you very much.
Kat had a question. Would it be better to ask residents to stop taking walks and exercise at home indoors?
I would worry about, I think if people can do that and feel the relief or benefit of the indoor activity or exercise, I think that's great. I think with all of the forward infection and spread of infection, in the back of all of this is the coping and the stress, and being in a close quarters. You know, everybody on a rainy Monday morning doesn't mind staying in bed an extra hour, but then when you're in the scope of a pandemic, the feeling around that and anxiety is really palpable. It's real. I would hate to put an order out like that one. I think it would be very difficult to enforce, but the other reality is the other reality is that this is not all of a sudden, we are not waking up, you know, on a certain day and it's all going to be gone. What we're talking about, social distancing on a bike path or even, you know, in our parks or playgrounds, it's going to be very different. And there will be different behavioral rules in our community. I don't know what it is or what it'll be, but sure. I mean, if you can, the more you can stay home and stay away from other people, the better you are. And I never thought I would say that. And that has to be balanced with people's mental health, their state, their anxiety, or coping and stress. And it's a very difficult balance. But I think I'm at the point where I can't believe that we are all talking to each other in Zoom about how we're going to stay healthy and alive during a pandemic, I guess.
And speaking of mental health, the next question is, are there any telemental health resources available for families that are sponsored by the city or free?
Yeah, so so one is the city doesn't have, the school department is continuing to work with River Valley Counseling that has, that worked with the school district before this happened, and that they have a client base and they're keeping in contact with folks and the families that they help in the schools. The second resource is calling 211, which is a statewide resource bank. And they have been able to connect folks with the telehealth and mental health. And my understanding is that there are still free clinicians and services that people can connect with. The state has an online health tool, BUOY, BUOY, .org, and that's free. I don't know, the last time I played around on that site, It was mostly connections of if you had symptoms of coronavirus, but they're supposed to be adding mental health. And then CHD, Center for Human Development, has also pushed out a couple of websites, and that's, I think there's chd.org, and that's Center for Human Development. They're based out of Springfield. I am working to get a list of those resources and a link up on my daily report and on the website, because we all, walking into this, we all have our own stuff that's extremely real. And then this on top of it, we can't make any assumptions, as we look on the screen at Dan, who has spent his life in public service and fire and, going across the country, that he's dealing with this okay. I mean, we just can't make that assumption. And we have to have, equitable tools that everybody can access, so they can work on their stuff, and then we all work better together. But I am working, those are the things I know off the top of my head, but we're trying to pull together a more comprehensive list.
Okay. I believe all the questions in the chat were pretty much answered. There are a few comments, but if anyone else has questions, feel free to chime in now.
I did see, Joe, something came up on the screen. So there is nothing, you just checked, there's nothing on the assessors?
There's nothing on the assessors, there's nothing on the tax collector's page, and there's nothing on the Unipay page.
Okay.
And a Google search of Easthampton delay property taxes does not bring up however you announced it in a search engine.
Okay.
So anybody who missed your announcement, including me, would not be aware of this at this point.
All right. All right.
So what's the delay until?
Huh?
When is it delayed until right now?
The end. My order is 14 days after the end of the city's declaration of emergency.
So it's open, so it's not a definite date at this moment.
No, but
it's at least until 14 days after May 4th, I'm guessing.
Yes, at least, right. And May 4th might be pushed out, like who knows?
I mean, realistically, I think the governor's going to want to do that, but functionally, I'm not sure how.
Yeah, I think too.
Until the state UI department gets its act together, and I shouldn't say it that way because they're so overwhelmed, but until that happens and the banks have more clarity on the SBA lending processes and things like that, I'm not sure how many folks are going to feel comfortable with that, but I think the reality is that that's what needs to happen.
I don't disagree at all. And I would just add to the order I had around late fees and waiving of them. I haven't read the detail of the House bill. The State House passed a bill yesterday, something about late fees and waiving and local option. And I need to make sure we're not at cross purpose, but my intent is to do 14 days after our city, a declaration of emergency ends. That's where I want to go. I haven't heard that the new law that just passed yesterday contradicts what I've put forward, but I am obviously going to triple check that, and I'll get the word out there online and put it in the daily report again so people know, and see what we can do about that Google search.
Okay,
excellent.
Great.
Thank you, Joe. Thank you.
Are there any other questions before we wrap up? Hearing none, thank you all for joining us today. Thank you, Mayor, Dan, Bree, Maggie, and everybody else who joined. I believe we had one question. Adam.Kinney, would you like to speak really quick before we end?
It wasn't a question. It was just a comment for people, for businesses or landlords that might have issues. I would recommend them checking the Massachusetts Housing and Economic Development page. There are resources there that might be able to help them. And then for people who are worried about like repercussions as far as like being laid off or losing their jobs because of this, the Attorney General's Fair Wages or Fair Wage website has resources for them.
Great.
Great.
Sounds like you should be a guest on one of these Zoom town hall meetings coming up.
No.
Well, no, thank you. That's great. Great information. I mean, there's certainly no lack of information out there. I think it's about culling through it and knowing what's working and what's not, and then, you know, getting on those systems that we really need, like unemployment and mortgage relief. So thank you very much, Jen, for organizing this.
You're welcome. Thank you,
Jen,
everybody, for
joining.
attending.
Yeah, and Maggie. Excellent.
All right.
Please, everyone, stay home. Stay home.